Roan is the sweetest little boy. He definitely has a little rebellious streak.
It was one of Rowan's favorite things, to ride with me all the time. If I had that machine on, he would always come, and it was just expected he'd ride with me. He ran in to get his bottle. He came running right back out, and he was just gonna ride. I wheeled the lawnmower turning while I'm heading backwards, and it turned right towards him and went over the top of him.
The closest hospital is about 25 minutes away. They weren't equipped for his injuries. They were like, he needs to go to VCU right now. And so they put him in an ambulance there, and we rode to the hospital. And so when we got there, I just remember a sea of people all around him, and I was behind, and I just knew that he was in good hands.
So I think Rowan had probably one of the most horrific injuries I've ever seen. Just the extent of his injuries involving both extremities was pretty frightening. That's why we got sort of a lot of our teams involved and had not only myself but our hand surgeons and our plastic surgeons involved.
And really, there were three main injuries. His arm was probably the most dramatic, but he had an injury on his thigh, and he also had the injury in his foot. Really the arm that got most of our attention.
You know, there's not really an algorithm to follow or sort of a textbook answer as far as what to do in this type of situation. So I think it was really helpful to have lots of people kind of give their inputs and talk to each other about exactly what to do and how we can help them.
Dr. Isaacs came in. It was he and Dr. Horstman that were working on him, gave us a pleasant surprise and told us that they were going to try to save his whole arm and his hand because he still had all the blood vessels and nerves and everything he needed to keep his hand alive.
Hand surgery is interesting in that it really combines elements of nerve surgery, blood vessel surgery, plastic surgery for soft tissue coverage, but often partnering with the pediatric surgeons so we combine the knowledge of both how to take care of that kind of level trauma, but also how to focus our care on the special needs of a child.
They were trying to help us as much as they were trying to help Rowan. And,
I mean, they accommodated. I had Adam while we were there, and
you know, we're in the PICU at the time, and we know that her due date's coming up, and they took over, and you know, like that's just a small example.
They even had a wheelchair outside of the PICU.
They took it upon themselves to just set everything up for the delivery. Where is it? Is it this one? Oh, you got it on the first one! You did it! He goes to occupational and physical therapy at the Bon Air Children's Hospital, and they're amazing. Like, they play games with him all the time.
So basically, our goal is to make him as independent as possible in what he needs to be doing at his age. Anything that he needed to do across his day, we were working on him becoming more independent at it, getting him to use his right arm, and then working on strengthening his hand and providing him any kind of external supports that he might have needed to compensate for muscles that he had lost. You know, I think his personality, he's strong-willed, active, smart. He's doing great. There's really nothing that he can't do.
Every single person we recognize as being just the best for us. They were so helpful and so saved our family, and we would not have had such a miraculous outcome without everybody.